So a lot of stories like this are there. For sure, for us, it's what it is to bring more attention to South Sudan with this report. But an access is not there. We have also our obligations towards the population of South Sudan. But once again, it's not only the obligation of the donor community or the international humanitarian community, it's also the obligation of the government in South Sudan to step up.
Thank you very much. Please.
Thank you so much to everyone on the panel. My name is Spencer and I work for REACH. The IPC, the Global Hunger Monitor, has issued 3 risk of famine statements in 2025 in South Sudan, which is the highest number, at least in my time in the country. And the proximate driver of these conditions has been the disruption or the obstruction of life-saving services, and especially humanitarian food distributions. Terian, WFP has successfully re-entered some of the most affected areas. Fangak, Ulang, parts of Nasir come to mind. And I wondered what approaches or strategies have proven most effective to negotiating access across these dynamic areas of control that you mentioned.
It's not been easy. We've done a few things. We work together with other humanitarians, the Access Working Group, OCHA, NGO Forum, etc. Collectively, we are stronger, and we all need to be in there because famine isn't prevented by just food. We also need healthcare in there. We also need wash facilities. There's cholera outbreaks in these areas as well. We all need to be going in together. So going in as one is important in that collective advocacy, that collective negotiation. Putting humanitarian principles first, making sure we're communicating with all parties and that everyone knows the circumstances in which we will go in, neutrally, impartially, operationally independent, and putting people in need at the forefront and serving based on need. Putting the humanitarian principles there and sticking with them has been a really important part. Showing all sides that we are delivering in all areas and making sure that that does in fact happen and that we will deliver in these areas together. That's been part of the strategy that we've been able to implement and how we've worked with other actors in order to do the same.
Thank you, Terian. Indeed, it's essential and partial humanitarian access is enabled everywhere. Without it, far too many people will be left behind. Do we have other questions from the room? Online? Maybe a question then for you, Sylvia, if I can. With limited funding expected, where do you think that, how can we ensure that what aid does exist reaches communities that are most directly affected? And maybe a second question, if I can, linked to the idea that donors should also be helping hold parties to the conflict accountable for attacks on healthcare. How do you see that? Holding parties also accountable for attacks on healthcare. How do you see that as well in South Sudan today?
Thank you. So in terms of reaching communities, and I think one of the things we have been collectively discussing is how can we maximize the first point of contact with those more affected. And that goes back to the community approaches that you were mentioning and reinforcing BOMA initiative, community health approach, whether that's for integrated management of disease, but also the possibility of community management of severe malnutrition when it's not complicated. So looking at those possibilities of really reinforcing the first point of contact, but that goes together with a strong referral systems to ensure continuum of care, which touches on the very important issue of access and making sure that access and it's granted, so that even if you are able to reach communities, you are able to refer those cases that need higher assistance. So that would be one of the things. And then the other thing is the accountability of affected populations. And this is something that I think donors are more and more putting as a condition for supporting partners, making sure that the humanitarian assistance is really responsive and taking into consideration the needs and the rights of patients and communities, and making sure there are systems to ensure that accountability. No?
Thank you very much. Other questions? Yes, please. Right behind you.
So I'm Céline Léonet from ACRC. Thank you very much for this opportunity, very interesting. I have a question for Honorary Dr. Korczek. You have here a good representation of humanitarian actors in the room, and so it's a bit of a question bouncing on the exit strategy. What do you think if we were to leave tomorrow? So beyond the financial gaps that you see, but what are we leaving behind, especially in terms of competencies? How do you see that the contribution of humanitarian sector has been in competencies in healthcare?
Thank you. I think for us, the stakeholders in ABA, I trust these partners who have supported health services in ABA. Because without this partner, I believe I used to say every time, without these partners, all the health system will collapse down. This is what I see. So I trust this what these partners are doing on the ground. I think they are doing great, but also there is a more need because 60% of the health facilities are not functioning for two reasons. One is the insecurity, and the second thing is the lack of the resources. I think this is why. Unfortunately, we came here for this summit thinking that some of these challenges will be solved, will get way to be solved some of these challenges. But unfortunately, the World Bank and the HSTP also came up with a decision that some health facilities are going to be reduced from different states. So I don't know what to say. So while we are supposed to move forward, we are going back with the more challenges and added in case to solve some challenges. Yeah.
Thank you very much, Honorable. Others, please.
Hello. Yeah. Thank you. I'm Marc Serre-Rivière. I'm the new director of INSO there, so I'm very new in the country. So I have really a first question is, but for you, Sylvia, you are talking about the most affected population, and I'm sure that, and because also we have a lack of funding, this is most costly to reach the most affected population. Probably because I'm very new in the country, but I know some other countries, so compared to the other, and because of the logistic constraint and so on. And so it's also a question for you, Honorable, because there is some criticism from the government against the NGO and the humanitarian about the logistic cost. So how we can manage the donor side and the government side also.
Thank you very much. So it's a question for them both around logistics costs. Indeed. Sylvia, can I pass to you first, please?
Yes, no, that, for sure. I think that, as we were saying at the beginning, in terms of prioritization, it also goes in terms of how to look for some efficiencies, in terms of also rationalization, share services, and taking opportunity, for example, of pre-positioning stocks and supplies when in the dry season instead of, which also means that on our side, donors, we have to try to find ways of aligning the moment in which we allocate funding, which is not easy, to make sure that those enablers are also supported in a way that reduces the cost of operations. But I think it also talks about integrating services. And we have been encouraging, for example, a lot in terms of integrating, for example, nutrition services into routine activities in health facilities so that you can rationalize the staff the cost of operations and so on. So I think it goes on that direction. Yes, cost of operation is high, but there's ways of trying to make it more efficient, but we have to collectively agree on what are the key agendas that we have to support, and then make sure that we can align in terms of putting our mouth, the money in our mouth in that sense.
I think state the example in South Sudan. So when we came to South Sudan in general for this year or for these challenges, I believe one for me, according to my opinion, the priority for us, even the movement of health personnel to health facility during other supervision support or assessment or other thing, or to deliver health services, there is a need. The priority is the peace. South Sudan, we have to thinking about peace in all the country, across the country. This is one. This is needed. We need peace anyway in South Sudan. If we have peace, I think the movement of the people, even the health person, I think will be good. The second thing for me, I think also is our government also is supposed to look to give priority for health sector at different level. Because without health, we are not going to have a productive community. I think this is very important. So government is supposed to allocate either at the national level or at the different level in South Sudan. Government have to locate some budget for the health, because without health, even the teacher cannot go to teach the children or other activities, even the farmers, they cannot do these things if they are not healthy. Partners also we cannot leave our partners to do everything for us. I think there is a need also for us to look to manage the little resources we have, to give the priority for health. I think this the main what I see. We have to move forward. We have to encourage our partners to do more, and even for the government in different level, I think also we have to contribute and we have to participate for improvement of our country, even for the prosperity for our people. This is what can I say. Thank you.
Thank you very much, Honorable. Yes, please. Ben.
Yes, thank you. Ben Greenacre, MSF. This is for the WFP, but very happy for anyone else to jump in and chime in if they have thoughts. So I think as the report illuminates, right, South Sudan is one of the most dangerous geographies for humanitarian workers in the world. And both in South Sudan and in Gaza, we've been witnessing this new, quite worrying trend of private actors emerging who are not neutral, they're not impartial, they're not humanitarian, but they present themselves as these private sector quasi-humanitarian organizations that, in the words of the new humanitarian and certain scholars, are conducting, in effect, counterterrorism operations under the umbrella of humanitarian operations. They use military objectives, arguably, for the storage and transport of this aid, and they sort of fundamentally blur the rules of distinction, fundamental rule of distinction in armed conflict. What's your view on this? Is this the new normal? Is this something that we have to adapt to, and cognizant of the need to keep a clear division between us, but they may well be key actors in our areas of operation? How do you see us adapting to this? Thank you.
So a small question, and not controversial at all. I mean, the humanitarian space is always evolving, and these kinds of actors are not new at all. They've been springing up in different areas, and they do pose a challenge. Not all of them act in the same way, and not all of them are aligned in the same way either. From our perspective, we need to keep an eye on what they're doing, be clear about how we operate, be clear with all forces, all parties about how we operate as humanitarians in this space in order to ensure that we are able to protect the space that we can to reach the people in need. They don't always reach all of the people in need. There's certainly a lot of space in South Sudan that requires reaching people. So I would say that deconflicting with other actors and ensuring that we do protect the humanitarian space that we live in, that we work in, that we abide by the humanitarian principles ourselves, and make sure all other actors and parties understand about how our operations work.
Thank you very much, Tarian. Indeed, from all the interventions we've had so far, it's true that we can't let this be the new normal for 2026, and that we certainly can't let be the new normal in the humanitarian sector here in South Sudan. Do we have any questions from journalists in the room? As Siggy said, one of the key elements that we need in South Sudan is more attention on the conflict and the ongoing health challenges here. Are there any questions from journalists we'd like to take? Please.
Yeah, thanks. I think my question's fairly straightforward. I'm wondering if MSF has received any explanation for what happened in Fangak or any of the other facilities that had been attacked. I ask that because I think an explanation as to what might happen might provide some reassurance that something similar might not happen again in the future, or that whatever went wrong is going to be corrected. Have there been any constructive conversations with kind of counterpoints in the security sector or with armed groups to provide some reassurance that this isn't going to happen again?
Thank you. What was your immediate house? Sorry, in your name?
Sorry, I'm Joe Falzetta. I work with the Associated Press.
AP. Thank you very much.
Thank you very much for this question. Investigations are still ongoing to have a clearer picture which is behind these different attacks, because there were different scenarios. But for sure, for us, the main concern is to call out for every actor to respect health facilities and humanitarian workers, that they can have a safe environment to work. So this is our main challenge. We are not the ones finger pointing, saying who is responsible for what. For us, is the major call is for all armed actors to respect humanitarian facilities, health facilities, humanitarian agencies, and healthcare workers particularly.
Indeed, because the ones who pay the price is the population that loses access to care in the end. And these attacks are what threaten their lives more than anything in that sense. Other questions? Yes, please.
My name is Tariq. I'm the nutrition cluster. Thanks for having us today. And I think I take the opportunity that we have MSF, we have WHO, and we have WFP. And I think one of the questions that we have been facing a lot during 2025, I think, is South Sudan, with all the vulnerabilities, with all the perfect storm we are facing, is it a humanitarian context, 50%, or a humanitarian context, 100%, or development context? Because currently, even for us as coordinators, we face this difficulty, that there's the narrative on development within the humanitarian context, and I think collectively, we need to come with a message that best describes the situation. For me, humbly, I think we are very far from development in the context of South Sudan, and yet the humanitarian needs are vast, and we have to focus with the resources we have to address these humanitarian needs. Thank you.
Excellent question. Maybe Dr. Karmagi, how would you see that one?
You give me the most complicated question, yes. I think sometimes, yes, I know this, we've been having this discussion quite a lot as we're trying to support the country. A lot of our colleagues in the government and even the donors, I think this is